Good afternoon.
Hello. Thank you, Nanette, for all that you do.
My pleasure. Happy to help.
Yes, yeah, and specifically for throwing together this meeting. We'll get started as soon as, for anybody watching, this is a special meeting of the Board of County Commissioners to discuss a letter to the governor asking for statewide action to control COVID-19 spread. We will get started as soon as the rest of the team is here.
Gentlemen, I heard you. I was just trapped in the waiting room.
Sorry about that, Randy.
That's okay. I wasn't there very long. You weren't remiss. I was just sliding in under, sliding into home plate under the tag.
So, did you score a touchdown? Never mind.
That was a baseball.
Oh, it was a three-pointer. A three-point.
Oh, that was baseball.
You don't know your sports at all.
Swing and a miss, George.
You're a soccer fan.
I've got the Thanksgiving spirit. That's my mom's favorite joke when someone tries to talk about sports, is to throw in some reference to some other sport.
I only made about like 2 or 3 good athletic moves in my entire life, and the only time I never slid under a tag, but I literally slid around one time playing college intramural baseball, and literally saw the catcher's, as I was coming in, I saw the catcher's mitt, and he went really low, so I couldn't slide under it, and I hooked my legs into a C and went around his mitt and the ball and over the plate and was safe. It was amazing. I couldn't believe it. It was blind luck, That and the time I caught that fly ball while I wasn't even looking at it, it accidentally landed in my mitt, running away from what looked like a home run. Baseball was not good to me. And I wasn't good to it.
Probably nobody would be surprised to hear that I was that kid that was more focused on the butterflies and the dandelions than what was happening all the way at home plate. And so the most athletic move I made was probably like catching a butterfly.
That's pretty good.
Thanks.
Are we
I'll make a phone call.
yeah.
See where the third amigo is.
Uh-huh.
We need to text the Zoom link to Sean. But it needs to be done via text.
Okay,
You got that, Nanette?
let's see if I have his cell number in my phone.
I do.
I'll do it. I can do it right now.
I just don't
Okay.
know where to access
Thank
the link.
Thank you, Peter.
Sure.
Maybe we should just all do it.
I'm up for that option. There he is.
Hey there. Sorry about that. For some reason, I had that on tomorrow's calendar.
Yeah, we did go around in circles on that a little bit, but when we do it,
Yeah, no problem. Okay, so it is November 3rd, November 23rd. It's 1:07 p.m. This is a special meeting of the Board of County Commissioners to consider approval of a letter to Governor Jared Polis urging statewide action to control the spread of COVID-19 in Colorado. And so Dr. Ryan has written this letter. It's very similar to a letter that was written by Jefferson County Board of Health. And so that's what we're here to talk about. Who wants to talk first? Actually, Dr. Ryan, would you like to just describe what's in the letter for those who are watching?
Absolutely. Thanks, George. So just to give a little bit of broader context, CALFO, which is the organization representing the public health directors across the state, we submitted a letter almost 2 weeks ago requesting of the governor to issue a statewide mask mandate to help stave off what has been now a 2.5+ month surge in cases, overwhelming our hospital system. That letter was more or less ignored. And we have been, prior to that, asking for several months for the same statewide mask mandate to help reduce the transmission of the virus. So in this letter, basically what we're asking the governor to do is issue a statewide mask mandate. The piecemeal sort of efforts of the different counties within the state make it much more difficult to enforce or have a direct impact on the current number of COVID cases, and more importantly, the hospitalizations that are occurring. So what this letter outlines is basically to follow the CDC guidelines and implement a temporary order requiring face coverings in all indoor public spaces for individuals 2 years and older. In addition, engage and prioritize the stakeholder process to discuss and implement innovative ways to increase our statewide vaccination rates, basically what it says in earnest. The statewide rate is at this point north of 70%, but 82% of those individuals being hospitalized at this point are the unvaccinated. That's 82%. So far, the governor has relied on a message of get your booster dose and protect yourself and monoclonal antibodies. Neither one of those things have been able to address the surge in cases and hospitalizations we've seen, primarily because the vaccinated aren't the vast majority of people who are going to the hospital, one. And two, the vast majority of people going to the hospital are not interested in experimental drugs such as monoclonal antibodies, which is a treatment for early COVID-19. So the impact that has had on reducing hospitalizations has been absolutely minimal. And other than those two protocol and strategy, the governor hasn't put forth anything yet in the last several months that we've heard of, or even remotely on the table, to help stave off what is an impending collapse of our medical system. As of this morning, there are over 1,600 people in the hospital due to COVID. Last week, there was less than 70 ICU beds remaining in the state. More importantly to that, it isn't about beds or bed count, it's about staff and the ability for staff to address the beds in the individuals we do have. Staffing is absolutely exhausted across the state, medical staff, and many are quitting in droves because of the exhaustion and just basic reality of what's going on. So increasing bed count doesn't really change the scenario. We need to do anything and everything we can at this point to help reduce transmission, which will only be made worse by Thanksgiving and Christmas holidays over the next 6 weeks or so.
Thank you for that background and describing what was in the letter. I'll defer to Randy or Sean, whoever wants to start off.
Well, I'll just state that and maybe you can speak to this, Tim, because I only have it as anecdotal hearsay, but I've heard that part of what's going on right now in order to keep ICU beds, at least the few that are open across the state, and hospital admissions down, is to there's already a good deal of discouragement of people from coming to the hospital until they get to a more serious state. And I don't know if anybody has any data more than just that, like I said, kind of some hearsay stuff that I've run into talking to a couple of people that have connections, with folks in the medical field, that, things like being told not to come to the hospital unless your blood oxygen is under 80% or something like that, that it's that you're at a pretty low level, which is also an indication that we're pretty close to the edge on it. Does anybody have any better information on that than I do?
I've heard anecdotally similar scenarios. Individuals, unless you're in a life or death situation, you're told to basically go home. There's a crisis standard of care. Unfortunately, they're unable to manage anything other than absolute emergencies, given the restrictions on beds and staffing for that. So, right, if you're not literally dying, they're not going to accept you into the hospital, which is unfortunate. It's also eliminated many of the preventive measures that hospitals typically do for individuals who are sick with other than COVID. Those are going by the wayside because of the situation with COVID.
In response to that, Randy, I know a person in my life got COVID, was not feeling well, wanted to go to the hospital, and was told that they needed to go get a SpO2 monitor, a blood oxygen monitor, and that it was only when their blood oxygen was at 80% that the hospital would admit them. They were told to wait until they were showing 80% on their home monitor, and then call and not just show up at the ER, but then call. And so to me, I mean, that's pretty, assuming that story is true. I think that those are exactly the kinds of outcomes that are kind of a bright line for this board and our duty to control the spread of COVID and make sure that if someone ends up with COVID who lives in this community and needs medical care, they can access it. And so in my mind, we're at or already on the other side of that bright line where this board needs to.
Okay, thanks. I don't really, and I don't know what the normal criteria is for that, if that is a regular criteria or not, but anyway, thanks.
Yeah.
And just to put a local context on it, also stated in the letter, we've had 14 hospitalizations in the last 6 weeks among Clear Creek County residents.
Dr. Ryan, how does that compare? Is that as much as we've ever had? How does that compare to like last December, which I think is the other really critical moment we've had during this?
The last 6 weeks have been the highest rate of hospitalization we've seen to date since the beginning of the pandemic for Clear Creek County residents.
Okay. So yeah, I mean, I support sending this letter. I don't think we need to spend a ton of time talking about it. I do want to leave space, Sean, for you to offer any comments. And Randy, I see that you just unmuted, so.
Yeah, I just wanted to say that I was kind of wanting to hear that also first, but I support sending the letter as well.
Thanks for all that good information. Tim, of the 14 hospitalizations, how many of those were unvaccinated?
Well, currently across the state, 82% of those in the hospital are unvaccinated. That fluctuates anywhere from 79 to 84%, I believe, at some point. Among our 14, I don't know off the top of my head how many have been unvaccinated, but it mirrors the state rate. So the vast majority of those are unvaccinated.
And what percentage of the 18% had some kind of underlying condition like cancer or, suppressed immune system or something like that?
Of the 18% who are hospitalized who are vaccinated?
Right.
I don't know. I don't know what relevance that has to the hospitalization and the limited capacity of the hospital.
What it has to do with is what I perceive to be a very heavy-handed solution that is applying to many people who are not at risk for themselves or others. And I still haven't really seen any evidence that, so I've been vaccinated. I haven't been tested in a long time, so I don't think I've ever had COVID. I've had my booster shot. I do avoid large gatherings, although I will go into the supermarket and make my strategic purchases and get out of there in a few minutes. And one of the things I've never heard anybody really hardly talking about is the negative impacts of wearing masks. And I feel like I'm a pretty good listener and a relatively good communicator. And I personally have a hell of a time having a conversation with someone with their mask on, let alone if they're not a native English speaker. And I think there's just a lot of negative consequences associated with this prescription that no one talks about. And I think for people who are in good health, who are vaccinated and boosted, I just don't think the prescription makes any sense. And so, and the other thing I would say is, but with all that said, I very much appreciate this conversation. I know that we're in a critical situation with our healthcare system. I mean, some of that's caused by the vaccine mandates that have caused many healthcare workers to leave their profession when they're needed most. But all that aside, I think we should be doing whatever we need to do to have whatever positive effects that we can have. I just feel like, number one, I don't know that the prescription fits the condition. And then number two, I don't know that we've ever sent a letter to the leadership of our state telling what they should or shouldn't do. And if we're going to start doing that, I've got lots of good ideas to send the governor letters.
Well, I mean, based on that, it sounds like we may need a motion. I'm willing to make a motion to send the letter. So since we have set this up as an action session, I'll just say I move we send the letter to the governor.
I'll second that.
Thank you.
Okay, so we have a motion and a second. I'll open it up for discussion. Sean, I am curious to hear from you what kind of alternatives you see. I'm presuming that, as a member of the Board of Health, you embrace a duty to control the spread of COVID and make sure that when someone needs to get to the hospital, there's a slot for them. Do you have any alternative pathways you recommend or would like to see this board take?
Well, I mean, I already mentioned it's unfortunate we discouraged our frontline healthcare workers from having the capacity to do their jobs by making them choose between their personal healthcare choices and being able to do their job. But that's water under the bridge. I mean, I think the situation we find ourselves in is largely the result of a lot of decisions that have been made up to this point that are similar to this idea of a mask mandate and asking the government to do that for us.
Are you suggesting, Sean, that our hospital crisis is because of things we've done about COVID as opposed to being about COVID itself?
I'm not, that's a broad statement. What I'll say is I know that I talked to someone just today about a particular system that is, if I didn't misunderstand her, is operating with 40% of the staffing that they had only a few months ago. And that a large part of that is from people who elected to choose not to get vaccinated rather than to keep their jobs. And that is a policy decision that we made as a society to address the pandemic that I would say in some ways has backfired.
Was that in a hospital?
Yeah, that is a hospital, yes, one that you know.
Thanks.
My conversations with the head of the trauma unit at MCR and the head of the residency program at UC Health are counter to that. And the COVID vaccine is no different than every other vaccine every other medical healthcare provider is required to have to be in that profession. So anecdotally, over the last several months, exhaustion has been the top priority and reason why people have quit, not a vaccine mandate. Which is in line with every other vaccine mandate that healthcare providers have. So, and splitting hairs at this point, I don't think that's really relevant. The situation is what it is. It's public health. One of our responsibilities to help stave off the collapse of our health system, which provides healthcare for all. And anecdotally, I know people do this or do that. People choose not to wear seatbelts, but we still have a seatbelt law. Why? Because it is effective and it is meant to protect the vast majority of people who choose to do the common sense thing and wear a seatbelt. So suggesting that we shouldn't have something because there's going to be people who don't abide by it, we understand that. That isn't really what it's about. It's about protecting the society in general, not individuals in it who choose not to do or to do something. So whether they've quit over a mandate, perceived mandate, or they have quit because they're absolutely exhausted because 2 years into this thing, they're now having to deal with people who really don't believe in science, who come into the hospital who are sick. That's the primary reason people are quitting.
Yeah, well, I heard the word anecdote like 10 times so far in this conversation. And in the absence of any facts, I'm not going to engage in that debate right now.
Okay, so what's on the table is whether we would send this letter. We had some discussion. I don't have any further comments. Does anybody else? Okay, then I'll call the vote. All in favor?
Aye.
Aye.
Nope.
Any opposed?
Yeah, I'm opposed.
Okay. The motion carries. And as far as signatures on this letter, probably the easiest thing to do is, Nanette, if you are willing, you have my permission to sign this letter for me.
Same.
Yep, I can take care of that. Thank you.
Okay.
And I think Beth, when I voted against the countywide road closure, I think she just wrote the word no where my name appears.
Okay. And did you vote no on this, Sean? I'm sorry, my internet connection
He
kicked me out.
did.
He did.
Yeah, I did.
Okay.
Sean, perhaps it would, and I suppose it's really up to the board how you want to do this. We can simply remove your signature line as a possibility. I have to look at the letter to see whether we say that the commission here encourages it or Clear Creek County does. Just want to make sure that we're consistent that way. So if you don't have an objection either way, it may be easiest just to remove your name from the signature block.
Yeah, this is a Clear Creek. You know, we vote on something, and so Clear Creek County's position is now to send this letter. That's why we hold a vote.
Yeah, I mean, I don't have strong feelings about it. I mean, I think the governor has a really tough job, and like I said, there are lots of things where I would love to send a shell across his bow, but this isn't one of them.
Yeah. Okay, I mean, my preference for what it's worth is to have the chair execute the documents that are approved by this board. That's my standing opinion, but we don't have to resolve that here.
Yeah, I'm 100% fine with that.
That would actually make more sense to just handle it that way.
Sure.
Okay, so then,
We're all clear on which way that is?
Yeah, so the way the letter reads is that the Clear Creek County Board of County Commissioners recommends that the governor enact this mask mandate. It'll be signed by the chair of the commission, and that will satisfy that language.
So only the chair is signing it?
Yeah, it would only be the chair signing this. Otherwise, we have to say the undersigned commissioners of Clear Creek state this, and I think that may.
But why? I don't understand why, because the county just took a position by its vote.
Right. So do you want all three signatures of all three commissioners, but one being a no, or do you?
Can't you
just
put two
want-
signatures on it?
Yeah, why can't we just put two signatures on it?
Yeah.
That's why I asked the question. I don't think it wasn't clear as to what was going on there.
Honestly, that would be, I mean, that's my preference. is
Yeah,
that
I don't
we
have a choice. I don't have a preference, but I want to make sure the board understood that. I don't think they did.
No, that makes sense. Well, then that's up to you guys. Certainly.
your call, Randy.
Yeah, there's, you know, for my own reason, I would like to have my name on that letter going out as well as yours, George. And as far as how you handle the signature line below that, that's
Up to
you know,
Sean.
put the two on them or whatever.
Sounds
Yeah,
good.
I'm happy with letting staff figure out what they want to do with that. I mean, everyone knows what my position is.
Thank you, Sean.
Okay. That concludes the topics that were posted to talk about here. Peter, I believe that just like we could at any moment, we can talk about scheduling matters right now. Is that correct?
Sorry, that is correct.
Okay. So you guys probably also saw, or you folks probably also saw that Arapahoe County, Adams County, Jefferson County implemented local mask orders yesterday. I think that I would like for this board to consider a local mask order in Clear Creek County as well. If there is consent from a majority of the board to do that, maybe we can talk about when to schedule that meeting.
Yeah, and I know it's said this a couple of different times, but my position regarding scheduling meetings is
Sean, yeah, looks like you muted yourself.
We lost you, Sean. I think you hit your mute button.
Saw it come off for a second, but you're right back on.
Well, I'll just, in the event that, are you back, Sean? Have you got your
Yeah,
voice?
sorry about that. Somebody called me. I'm taking the meeting on my phone. What I said is, I'm happy to have either one of you schedule a meeting whenever you think it's important. I don't want to use my vote before a public conversation about the merits of having a public conversation. So I think you both know that you always have my vote for creating a majority to have a meeting if you think it's important.
I think we've all been pretty collegial about that. And I appreciate that. My take on it is that I think we should do that. It would have been nice to have had more time to look at it. I'm a little reluctant right now with Thanksgiving on Thursday and Friday being a holiday for most people. And it already being 1:31 in the afternoon on Tuesday. I mean, is it possible to call one for tomorrow evening? Yes. Is it a big deal? Yes. Is that as responsible as maybe we ought to be to the public, is to try to have a meeting for a mask order tomorrow afternoon? I've got some heartburn over that, and I'm thinking that we should pull it onto an agenda for, if we have to call a special meeting or something, or, then it would need to be a meeting next week. If we don't do it right now because we're past the weekend. So that's just my initial gut level reaction to it. Would love to hear from George, Tim, Sean, anybody else, Peter, Brian, Nanette, whomever.
I think next week makes the most sense as well.
Yeah, that's fine with me.
And then the answer is when, or the question is when. Sorry, that's not an answer.
Just as a friendly reminder, CCI is next week.
Yeah, right. First, so we're probably clear out to Thursday reasonably. Or is CCI 2 days or 3? I forgot.
It's 3.
Yeah.
I'm
So we're out to a week. We'd be out to a week from today, perhaps.
I don't think the first CCI agenda item on Monday is until 3:30, if I remember correctly.
Yeah.
I think you're correct, Sean.
Yeah.
I would just arrange my drive time to accommodate this. So I could do, I guess I would prefer either like in the morning between 8 and 10, or in the afternoon between like 1 and 3:30. Probably can have broader windows than that.
I can make any time work.
Given that that's probably true for all three of us, anybody else on staff have a complication or a preference?
No, the only I guess it's more the complication, but we're gonna need Nanette's help again because Beth is out the rest of this week. I assume this is something we could get done in terms of all the work related to getting this posted as a meeting tomorrow. So there's no more work to be done with respect to the meeting itself. And I see Nanette shaking her head yes, so.
I can get that set up.
Well, let's bring this up because, and this may have to do with what day we schedule it in order to have enough time to be able to do things, because of what is the actual workload that needs to be done, we have to answer the question: what is the meeting for, and what might we hope to accomplish at that meeting? And if it's just to continue a conversation about having a mask order, then yeah, that would be fine. If it's to ask staff to bring before us a potential mask order that would be, and my first thought on it is it would be compatible with those that our neighbors are doing, because many times we've said, let's look at what the large counties around us are doing and try to, mimic what they're doing, because they've done the research, they have these big staffs and things. They got really smart people and all that kind of stuff. Then, maybe we should say we should be scheduling both a discussion or work session and potential and action item, and have something in front of us upon which we could take action. In which case, with the holiday coming up, I don't know if that's fair to Peter and Nanette and Tim to pull that together in time for Monday morning as an example.
Well,
So-
and I can tell you, it probably won't be, if we are going to try and make it consistent with those other counties. Jefferson County, although they approved their mask mandate and intend to have it in effect starting tomorrow, they will not actually have a copy of the order until the end of the week at the earliest, which is an interesting way to go about doing what they're doing.
Yeah,
Adams County and Arapahoe, I don't know if Tri-County has essentially, if they have put out a mask order yet. I did not see it on their website when I went to look just a few minutes before this meeting. So I mean, it's reasonable that I could just take what we've used before, but in light of the fact that we have changing circumstances that are requiring us to be doing this again, it would be helpful for Dr. Ryan to be able to provide the basis to do that. And with that in mind, it may be easier and more beneficial to be consistent with those other counties. So with
Right.
that being said, perhaps not Monday, but perhaps if Thursday is possible, we do it then, and that will allow plenty of time to put that together. But, you know, we'll do what needs to be done. I just want it to be consistent with the other counties.
with regard to those other counties too, you know, we've also talked about the regionalization to have the people with whom we interface the most. If they're under similar rules and they're not so caught off guard when they see the same rules when they come here, which means that Jeffco is probably the one we would want to look at first. But then it also has to do with whatever Tim thinks about our specific conditions when he looks at that, to see if he concurs that that is the most appropriate route. And if that's not going to be out till the end of the week, you know, maybe Friday or something like that, then it gives, if we go Thursday, then it gives a couple of 3 days for staff to respond to that, digest it, and prepare something based on Dr. Ryan's recommendations.
Yeah, I think that makes sense. So Thursday, I don't know what your schedules all look like. Thursday, we're talking about Thursday the 2nd.
I think I'm surfing in Mexico, but let me look real quick. No.
And I'm sure I can make it work out. One thing I just wanted to throw out there, which people listening to this call probably won't care about, but I have no issue with people being a mask mandate for the unvaccinated. I mean, I'm not really 100% sure how the science supports that, but I think that there's enough anecdotal evidence around the unvaccinated protecting themselves and protecting spread to others. My issue is with the vaccinated, right? I mean, if we're on the one hand saying that vaccines are effective and safe and we recommend them, but you still have to wear a mask. I mean, to me, that doesn't really make a lot of sense to, you know, if you want to incentivize people to join the responsible club and get your vaccinated, or however you look at that, forcing them to wear masks is inconsistent. So that's whatever the next conversation comes up, maybe that'll be useful, that you know that that's how I feel about things.
I also see Cass Patton in the chat stating that December 2nd is that tourism workshop from 9 to 3:30, which I'm guessing at least some of our commissioners might have an interest in. I know I had an interest in it. Just throwing it into the conversation.
My Friday morning, 8 to 9, or Thursday morning, 8 to 9, are the two windows that fit conveniently. But obviously this is, you know, meeting as a board is the top priority, so I can move from there.
Right, and I have a 9:30 on Friday morning. I have something on Thursday morning at 8:45, but I don't necessarily, I can probably find an alternative to that. So either one of those, 8 to 9 on either Thursday or Friday, work to me. I'm good up until actually 9:30 on Friday.
Just remember, the tourism meeting is in person, it's not Zoom.
Mm.
So an 8 to 9 Thursday morning probably would have you at the tourism
Yeah,
board
that would be
meeting.
a stretch.
Yeah, I mean, it also kind of depends on how we feel about how this fits into our existing priorities. I mean, we could, for example, shoot over to the healthcare clinic and do the meeting in the conference room there, and then come back to the tourism session, because that's probably not going to take more than a half hour, 45 minutes, I wouldn't guess.
That's a good thought.
Yeah, I mean, I live in Idaho Springs, so it's gonna be pretty easy for me to manage.
Can we Zoom from that room? What do you think, Nanette?
From the clinic room,
Yes,
I have not,
we're setting that room up to be
No.
available for Zoom, but we got the equipment purchased, but it's not installed.
Right, we can just each use our laptops though, or our phones.
That's
True.
that's true. That's
Yeah,
true.
if we-
the
I'll
Zoom can
dial
be
in.
set up from anywhere. It can be set up.
Yeah,
from
that's true.
anywhere.
Beth can be in her office and, okay, we'll make that work.
Mhm. Yep.
True.
We can, I can Zoom from my bedroom, right, where I'm sitting right now, and be just fine. And I think that is some vacant office space, and so if Sean needs a place that's a little closer to the tourism bureau meeting, he can find one, and we can do a Zoom meeting and manage ourselves.
Okay, so Thursday or Friday, either one. And what time?
Someone who has an opinion can express it. It doesn't matter.
Cass, do you know, is there going to be a lunch break? How long? 1 hour? So we got 12 to 1. We could do noon on.
I'd rather not.
I knew that was coming.
Yeah, I mean, I think I'm more able to participate when I have moments in the day to treat myself like a regular human. So, okay, this is not a strong preference. I'm literally flipping a coin in my head. Let's do Friday morning. If somebody actually has a strong preference, please express it.
I don't. 8 o'clock?
Yep.
Yeah, that works fine for me.
Okay. So then we're scheduled for 8 a.m. on Friday morning.
Cool.
For everybody listening, we are talking about, scrambling for my calendar here, Friday, December the 3rd at 8 a.m. to discuss a local public health order requiring masks. And then I think, obviously, individual commissioners can feel free to, I don't even have to say this, reach out to Tim to discuss what that order could look like.
Right.
Because I don't think we really are in a position to direct that at this point.
No, and even to have that conversation with him is, I think we got to wait and see what comes out of. Tim, do you think we should wait to have any? I mean, we don't need to burden your time until you've at least had time to see what comes out of Jeffco, is my guess. I guess everyone's free to do what they want, but I wouldn't want to bother you until we even had a clue what we were talking about. So,
Yeah, and I'll reach out to my counterpart in Jeffco, see if I can't get a copy before it's made public.
okay.
I mean, I'm assuming that they're a public board and they passed an order on Monday, so it must exist. It has to exist.
Doesn't exist yet. They voted on it. They voted on the framework, but it actually is not done. And I suspect part of that may be that they're running it through the county attorney's office to ensure that all the Ts are crossed and all the Is are dotted. That's typically how it works.
So they might not, if their attorney's looking at it, my guess is they might not be willing to like sneak one over to us that the public hasn't seen yet.
Maybe. I'll rely on Tim to use his finesse to see what he can do. I'm also speaking with Alyssa about some of her contacts in some other counties.
Okay, well, in that case, thank you all for taking the time to have this special meeting today, as well as schedule a special meeting for November 3rd for us to respond to this. And we are adjourned.
Thank you.
Thank you.
Thanks.